to this brand new episode of Newsmakers, the show where we bring to you trailblazer personalities and their success stories from various walks of life. Because at Newsmakers, we aspire to inspire you. My dear friends, I'm your host Simran, and yet again we have another very dynamic personality with us on our sets today. We have the Managing Director of Labaid Cancer Hospital and Super Speciality Center. He is also the Managing Director of Labaid Chottagram. Please allow me to welcome Mr. Sakif Shamim on our sets today.
Thank you, Miss Simran. Yes, I'm doing really well. Thanks for having me on your show. It's my great honor and pleasure uh, to sit on this show. Thank you.
Now, Mr. Shamim, we would like to start with this very first question. Could you walk us through your journey of how you transitioned from your early career to becoming the Managing Director of Labaid Cancer Hospital and Super Speciality Center?
Thank you once again. So I have started my journey back in 2008. So basically, my father, who is the architect of Labaid Group, so he has started this business back in 1985, and I have always followed his footsteps. And after completing my bachelor's in finance, I have joined the business in 2008. Then I was the business associate for 4 years. Then I did my MBA from University of Chicago Booth School of Business. Then I did my master's in clinical service operations from Harvard Medical School. Then I went back in Dhaka, Bangladesh, and I have started as as a business development manager for 2 years at Labaid Pharmaceuticals Limited. Then I have started my journey as a director of Labaid Cardiac Hospital and Labaid Specialized Hospital. And there I have worked for more than 7 years. And back in 2019, I took the assignment as a managing director of Labaid Cancer Hospital and Super Speciality Center from zero. Like it's a totally greenfield project. And then I have started. And in 2021, I have launched this hospital. It's a 180-bed cancer and super specialty hospital. And this is the so far my journey. And then I have started Labaid Chottagram, and I have started other ventures as well. So it's the fastest growing healthcare group. We have employed more than 10,000 people across the country.
It is so good to hear that how you followed your father's footsteps and reached to this level in your life. Now, I would like you to tell us that what is your vision and mission behind Labaid Cancer Hospital? Now, how do you see its role evolving in the future of oncology in Bangladesh?
So the vision is very simple: to winning cancer. So that is the simple vision we have. But the mission is like to provide the most comprehensive cancer care service, providing clinical excellence, establish proper clinical governance, ethical leadership. So these are our fundamentals for bringing up this hospital and to build this hospital from the ground. So we have brought all the good practices, all the best technologies from around the world, and moreover, all international standards, protocols we are following. That's why we are making. And one more thing I need to add, that back in 2000, early 2000, even now, lot of patients are migrating from Bangladesh to different countries, especially in cancer treatments. So that is the thing. Then when I have visited different hospitals, facilities, so integrated service was missing. So our main focus was that it should be under one roof concept,
Mhm.
that all the services, all the facilities, ancillary services should be under one roof. So that is the main motto and main, I
Ajib.
think, driving factors to run this hospital.
Dear viewers, Mr. Shamim has a very clear vision, especially for the people in Bangladesh, to provide integrated services under one roof so that they should not migrate to other places to get the cure. Now, Mr. Shamim, as you mentioned that there are state-of-the-art facilities in your hospital, especially in the oncology department. Could you elaborate on some of these advanced services and how they benefit patients?
So we have brought two advanced true beam linear accelerator. We have for external radiotherapy. We have brought advanced PET CT scan. We have brought CT scan, MRI. Then we have brought flow cytometer. We have brought bone marrow transplantation unit. Then also we are doing advanced immunotherapy, hormone therapy. And also we have built 6 advanced modular routine for doing complex surgeries like complex head and neck surgeries, oral maxillofaciology surgeries, gastro surgeries, and one thing, our hospital infection rate is very, very low compared to other hospitals in America, in India, USA. It's like 1% in surgical site infection rate. And our cancer survival rate is now more than 3 years, is like more 70% people are surviving more than 3 years. So these are the technologies and treatments we have started at our hospital. And also we are now focusing on genomic studies. We are doing molecular biology tests, and we are doing a lot of other oncological tests at our hospital.
It's a great news for all the people of Bangladesh that Labaid Cancer Hospital has the advanced services and equipment all under one roof. You are also the founder of LifePlus BD and LifePlus Bangladesh. Now, how did you identify the need for such integrated healthcare?
So Labaid is always we are looking for the opportunities to solve common people problems. So for that reason, I was thinking that like nowadays people are going for tests to this hospital, for giving blood to other hospitals. Then they are taking multiple appointments, like like physically to different hospitals, and it is really time consuming. So for that reason, I have started LifePlus BD. It's the largest health tech platform in Bangladesh at this moment. We're serving more than 200,000 customers every year. And we have different services like doctor's appointment, then telemedicine service, then you can order tests also. You can record, you can also do EMR at your desktop, and you can also storage your healthcare data for more than 10 years. So so these are the facilities, and also you can order medicines and lifestyle products from that platform. So it's a very robust platform for all the integrated emergency healthcare services that you can take from your home and also from anywhere in the world.
So, you mean this is like an app?
Yeah, this is an integrated app, but we have our website version as well. So we are doing both services, but it's mainly app. So we are focusing on app only.
Now, this sounds wonderful. Now, we also know that Bangladesh did not have a good healthcare system. Now, what all challenges you faced during the inception of Labaid Cancer Hospitals? And how do you believe your organization is helping to address these issues?
So I think the major problems are shortage of uh, advanced healthcare facilities and basic facilities as well. This is the very common thing in Bangladesh because we have 180 million people in the country, but dedicated facilities are very limited, plus shortage of healthcare workers like nurses, technicians, doctors. So the ratio is uh, it's significantly low from other developing countries. So this is a very challenging task for us to retain those skilled people
Okay.
in the organization. And because I also believe in continuous training, development, continuing medical education.
Mhm.
So, so we are building those people, training those nurses, and sometimes the employee turnover rate uh, goes so high in
Mhm.
certain period of time, and also our consultants are also very limited. Like specialists are also very limited.
Okay.
Very, very limited. So finding good doctors is also a very challenging part.
Hmm.
So basically, to get doctors and all, also retaining them was always a challenge, and you are working diligently to retain them.
First of all, collecting or recruiting those doctors and managing and retaining those doctors is
Hmm.
one of the toughest job.
Now, you said LifePlus offers a range of innovative services like e-prescriptions and live tracking ambulance services. Can you talk about how these services work and their impact on patient care?
So basically, since doctors are doing prescriptions from our portal, so we have more than 2,000 doctors.
Mhm.
And as a user, you can also upload your prescriptions. And we have built AI engine.
Mhm.
So we are doing different types of making different types of assumptions by analyzing the data, and we are reaching for the precision medicine.
Okay.
So we want to that probably next year we will be launching that if our patient can know that whether within certain answering some questions they can get the answer that if they have a cancer within 10 years or 15 years or not. Tip it, analyzing their medical prescriptions, analyzing their data, and also taking opinion from the doctor, we will give those decisions. So this is a very big thing that we're building up now AI engine, and it's a very tough job, and we have a huge database at this moment. So this is the one thing for doing this e-prescription. And ambulance tracking, it's another service that we are giving, that you can track, you can get ambulance like an Uber, that from anywhere in the country, and within 30 minutes you will get the confirmation. And if you need any urgency, then you can reach out to our uh, dedicated call center and you can get it immediately. So it's like that if we have the availability of ambulances near your area, you can get that ambulance immediately, and they will connect with you and they will pick up those patients.
You rightly said AI has changed the whole system and it has made life easier. But please elaborate, how is technology transforming healthcare in Bangladesh and what role do you see for it in the future?
So definitely, because technology is making our life much easier, we can have lot of data, and I am doing data-driven decisions every day, every moment. So so data is the future, and this is the next big thing. And in terms of cancer hospital or in terms of Labaid, so it's a we are doing HIF integrated hospital. So we have uh, it's a fully paperless hospital. So
Okay.
everything you can have a patient registration card to discharge summary, which you can scan from your mobile and you can get it,
Hmm.
and you will have that medical records for 10 years, and doctors are doing medical prescriptions and medical reports you are seeing on your desktop. So definitely, uh, first of all, implementing these things was very challenging, in terms of managing different stakeholders, because in hospital we have multiple stakeholders that we need to manage. But ultimately, it is giving a lot of information in terms of, like, I have a full cancer registry where I can know that, so what percentage of patients or women are diagnosed with breast cancers, in which region, in which part, which age group. So, and what are their habits. So these are the things, surveys that is recorded through our online EMR, electronic medical records, and we can analyze, and we are continuously analyzing those data, and we are producing those data that our infection, hospital associated infection rate is less than 2%, surgical site infection is 1%, then our average length of stay is 3 days, and procedure wise also, even surgery wise also, that we, and then we can also benchmarking those things
Okay.
in terms of like in a hospital in Singapore or India, we can benchmarking ourselves that this is our position. That, so these type of decisions and data driven decisions we are taking every day, every month, every year. So this thing definitely making our life easier, and artificial intelligence is the next big thing in terms of genomic analysis. So we are collecting those data, and we are also planning for a big data for our hospitals, and we are already preparing for those things.
Could you also throw some light on your another hospital, which is Labaid Chottagram?
So our top cancers are like breast cancer, then head and neck cancer, then lung cancer, then stomach pancreatic cancer. These are our top cancers. So there are like so in breast we have lot of types of cancers. In lung we have not small cell carcinoma. We are getting a lot of head and neck cancers. So these are the top 5 things that we are getting at this moment.
AI is certainly the future. Now, Mr. Shamim, we have noticed that the rate of cancer patients are increasing, especially when we often hear of breast cancer. Please tell us what type of cancer patients are more prevalent in your hospital.
So it's a 100-bed multi-speciality hospital for our. It's the second largest city after Dhaka, after the capital. So it's a dedicated 100-bed facilities, which includes general surgery, gynecology, cardiac facility, and it's a dedicated 100-bed tertiary hospital that we will be in live within next 2 months, and it will be serving more than 100,000 outdoor patients, and more than 80 inpatients every day. And right now in Chattogram, in overall Bangladesh, we are having lack of good healthcare facilities. So in Chattogram, we want to start this state of the art facilities as soon as possible. And we have also standalone dedicated diagnostic facilities as well, which includes 1.5 Tesla MRI, 120 Tesla CT scan. Then we have a dedicated 10-bed gastro suites for gastroenterology procedures and a colonoscopy procedures for everything. And also we have a big lab at Chattogram.
We wish you all the luck for your new venture. Now, my last and final question to you, Mr. Shamim. You yourself are such a dynamic leader. What advice would you give to young professionals aspiring to become leaders in the healthcare sector?
It's a very challenging question. So I think it's like you have to endure the pain, because if there is no pain, there is no gain. That is the one thing, that entrepreneurship is not a cup of tea. So it's a very hard job. So if you want to be your own boss, first you have to make yourself that you want to go through a lot.
Yes.
So this is the one thing that you have to be very disciplined in your life. Yeah, you have to be very good in terms of managing yourself first.
Mhm.
If you want to first, you need to manage yourself, then you can manage some people, then you can manage some companies. And one thing, don't read for money. I think you have to read for the aspirations, the contributions
Mhm.
that you want to serve for your people, because it's like if you can't solve millions people or some common people's problem, you can't do business or you can't make uh, your dream comes true. So I think that is the most important part, that you have to solve, and you have to implement those things very properly and in a very good systematic way. Then you can be the leader, because leadership is a very tough job, and uh, and it is better that first you have to be yourself, that you have to manage yourself first, because
Yes.
then you can become a good leader.
What a wonderful advice that we just received is that we have to endure the pain because there is no gain without pain. Thank you so much, Mr. Shamim, for being here on our sets of Newsmakers. It was such a delight to have you.
Thank you, Simran. Take care.
And hey, my dear friends, this is Simran signing off, but I really promise that I am going to be back soon with yet another promising personality on our sets. Stay tuned and stay blessed.